Moving ahead with the last panel of the evening. The topic of the panel is gig workforce in healthcare through powerful AI. And to join this panel, I would like to invite Mr. Ravi Pratap Singh, Senior Vice President, HR, Regency Healthcare. Mr. Ravi Pratap Singh has been in the industry for last 16 years. He is the alumni of IIM Calcutta. He is ALMI designated professional from Loma, USA. He also worked with Max Healthcare Life Care Hospital Africa. Currently, he is heading the Senior Vice President position and Group HR Head with Regency Healthcare. Mr. Ravi Pratap, can we have a huge round of applause, please? Joining him, Mr. Anand Soni, Director, SVAG Consultant Private Limited. Imparting skills up courses in healthcare education, a strategic HR and learning development professional. Mr. Can we please, after lunch it's getting very sleepy, so you need to wake up before the awards. Okay. Everyone sit. I know you are excited for the awards. Joining him, Mr. Mukesh Sinha, co-founder Gravitas AI UK. Mr. Mukesh is a serial entrepreneur with over 2.5 decades of successful experiences in healthcare industry, healthcare ecosystem, pharma, surgical, medical consumable, alternate medicine, and medtech industry. And now he is the co-founder in Gravitas AI. Joining him, Dr. Omair Khan, PT, founder and president, Global Maharashtra Institute of Paramedic Science, and Dr. Omair Schools of Fitness Science, Advanced Rehabilitation and Fitness Academy, Pune. And last, I'm calling the one who will hold them as a moderator, Dr. Major Harleen Sujlana, I'm sorry. Dr. Sujlana is the BD, Business Development, JOBIZO. Major Sujlana is a physician who started out in the Army Medical Army Medical Hospital, ventured and trained formally in healthcare management and hospital admin. She has done a consulting stint with Deloitte, Fortis Hospital, and served a group medical director in her previous role. In her current role, she is heading the business director for JOBIZO. She is leading the tech platform from the front and hoping to revolutionize healthcare living. Over to you, panelists. Thank you very much for joining us. Thank you.
So a very warm good afternoon to everybody, and thank you so much for joining in today, taking out time from your busy schedules to be here and supporting us all. So and a warm welcome to all the participants here as well. Well, I would like to start, by reading out a report from McKinsey, which about the future of healthcare delivery. So healthcare delivery is fundamentally evolving to become patient-centric, virtual, value-based, and risk-bearing, ambulatory, in the home, driven by data and technology, enabled by new medical technologies, funded by private investors, integrated yet fragmented. So I think they've very nicely summed up the future of healthcare delivery globally. Well, consumer spending on wellness categories, including fitness, nutrition, appearance, sleep, and mindfulness, is increasing. In fact, is a high priority spending with consumers. We all know that it is cheaper to prevent a heart attack or a stroke than actually treating a heart attack or stroke. Well, starting with this very new platform, I'd like to ask Dr. Khan here, who has a very interesting skill development program for wellness resources.
Yes.
And I would think that you're majorly into post-acute care, post-hospital care. We all know no one wants to visit a hospital, and even if they do, they want it to be as short as possible. So I think you take over from where the hospitals leave the patients, at their doorstep.
Definitely.
Yeah. So could you elaborate on your venture?
Basically, first of all, I would like to thank everybody and Farooq sir, and I thank everyone. So being, everybody talked about management, we talked about treating disease, we talk about medicines, and we talk about how we can provide them, home services with less effort. Now, we being a physio or aftercare, we usually, not only with wellness, we treat a lot of cases with orthopedic conditions, neurological conditions, without medicine and without surgery. Or if it's with surgery also, we give them post-rehabilitation. So it's like rehabilitation adds a quality to life to all those years. Post hospital, or it's a very important, when it comes to wellness, we are also training doctors, we are also training paramedics as well as fitness related personnel. Basically, there is a huge industry I would like to discuss if I have time. First of all, we know, some percentage we have already discussed that major population has, even sir has some, has discussed about heart diseases, plus stroke or hypertension. We are into more of diagnosis, and many of the focus were around, early diagnosis, and now we are into discussion for prevention. So even as a medico, I think that there is a huge market, and huge market means wellness. So wellness means something, early diagnosis plus prevention of disease and improving improving the health. So in that we include lot of fitness types, and we train especially doctors who can comfortably train the patients in towards the prevention of the diseases, be it with form of exercise, be it with rehabilitation, be it with all rehabilitation exercise. So majorly we talk about spine conditions, say who requires at early, if we talk about, there are a lot of major back issues. It's an epidemic problem. Everyone, somewhere feels or suffer from back pain. So it's like it starts when we talk about early diagnosis. It's like being overweight, or say not having proper support system. That's a musculoskeletal condition. We all know that we are not physically active much of, and so the first sign which we get is postural change or something. So early diagnosis means, we assume that, and we make an awareness into that, and that's how we try to generate a lot of huge market for that, and yeah, that's how it is.
So actually a new specialty called, integrative and lifestyle medicine is now the trend. And as someone who practices diabetology, I cannot agree more, with the lifestyle modification that is required in most people to prevent diseases, and expensive diseases, and crippling diseases, which can take away their livelihoods, their, complete lifestyle patterns. So yes, I mean, this is of course very important. Even health plans are now covering preventive services in their packages. So are you collaborating with, healthcare providers or doctors, or you just train these resources? And what about the placement?
Actually,
we cannot have enough of these resources.
Definitely, ma'am. There is a huge market we need to understand. I mean, focusing on some specific disease, there's a huge market on prevention also. So likewise, as I said, we are into training more of doctors. So we have created a diabetes fitness program. So basically, we assess obese people. It's always they're into mesomorphic, ectomorphic, and endomorphic. According to that, we assess people, and we analyze according to the HbA1c. That's a 3 months, we get to know the sugar level. According to that, if it's pre-diabetic or diabetic or post-diabetic, that's the term of the course, yes. So according to that, we are collaborating with diabetologists now, and because definitely there are a lot of things. It's not the only medicine. It's the lifestyle modification plus exercise that's going to manage the whole diabetes.
Absolutely.
So we are collaborating with all the diabetologists, and now we all the diabetic fitness trainers, we are collaborating and we are posting them in those areas, in those centers, so that at least if they are pre-diabetic, they are able to avoid it, and if they are early diabetic, they can get rid of it. Not only just with fitness, but also with nutrition as well as and dieting. Plus, for those, because with diabetes over time, down the line, 10 years, people are very much associated with, along with diabetes, is CHD, chronic heart disease, or say, along with that, we have hypertension. So our doctors or our trainers are much equipped with all these testings, and with collaboration we have in-house, we have these facilities as well.
Great to know that. Well, in spite of technological advancements, one cannot do away, with hospitals totally. In the more complex and critical situations, we need to go to hospitals. And, well, even latest, modern, fancy technologies cannot substitute the contribution made by specialized manpower in the healthcare industry. Well, human resource is a very vital resource, a veritable qua non in the healthcare industry. And to err is human, goes the old adage, but probably this is not true for hospitals. So, well, Mr. Singh, I would like to come back to the traditional model of HR recruitment and ask you to enlighten us with the modern challenges in recruitment in hospitals.
Okay, so thank you so much. And any session post lunch is the most difficult session for a speaker, because it is quite difficult for us to make the people listen to us. So before I start, I would just like to check that everyone is listening to me or not. So can I request you to do a quick activity? Is that okay? So just take out your left hand and your index finger like this. Put your finger on your chin. I said put your finger on your chin. It simply shows that a lot of people are not listening actively. Okay, can we do another activity? Okay. So, okay, I'll ask a simple question. How many of us are male? Oh my God, it took so much of time for you to raise your hands. Again, let me ask. How many of us are male? Great. कुछ लोग अभी भी अगल बगल देख रहे हैं कि बगल वाले ने हाथ उठाया कि नहीं उठाया. Okay, how many of us are female? Male. Female. Male. Thank you. Now I'm sure that you guys are listening to me. Now I'll come back to my topic.
You've spoken like a true HR.
That's the beauty. Yeah. So the biggest challenge for us as HR professionals is scarcity of manpower. Now, if I really talk about, we are short of staff in healthcare industry, especially if I talk about doctors, nurses, paramedical staffs, or even the general duty assistants as well. It's very difficult for us to find them. Tier 2 and Tier 3, it becomes all the more challenging if we are in Tier 2 or Tier 3. Just to give you an statistics, that per 1,000 population, if I talk about nursing ratio across the country, our current ratio is 1.96 per 1,000 population. However, if you look at the developed countries like US, it has a ratio of more than 11. Even there are countries, where the ratio is around 17, 18. So look at the difference which we are having in our country in terms of the numbers, which are being produced. Even if I talk about doctors, we have just 1.34 doctors per 1,000 population. So that's because the shortage is there. Because of that, we will always find challenge to get people. And in that situation, what can be the solution? So we also think that, the solution can be upskilling of people, training them and bringing them up to a level that if a GDI is trained for certain period of time, he or she may take the job of a nurse as well. 50% of the job, let's say that, he or she may not be able to take 100% of the job. So these are the remedies for that. So challenges in terms of, manpower hiring is, also we can definitely, as we are talking about gig workforce, that was the topic. In India currently, there are 15 million people who are being benefited as an employees as part of the gig workforce. And as per the survey of basically, if I talk about as per the survey of BCG, Boston Consulting Group, they have said that India has a potential to have around 90 million gig workforce, excluding farming industry. So what does that mean? That means that additional $250 billion of money can be there in the economy, which will contribute to incremental 1.25% in the GDP. Basically means ki if GDP is 5%, it will become 6.25% if that happens. So that's where it is important that technology-based solutions can come into the picture, upskilling of the people can happen, and then that's how we'll be able to cope up with these things.
So not only the staggeringly high attrition rate, I think is a challenge for the hospitals, also retaining the trained employees. That itself, given the mass migration of population, more aspirational nurses who actually everybody wants to go abroad. What do you think is the fix? How do you retain these trained nurses?
So, if I honestly tell you, all the hospitals in India, majorly we have been partially successful in retaining the nurses, but not completely successful. Nursing attrition rate across the industry is more than 40%. In hospital specifically, if I talk about, there are places wherein even it is higher than 50%, the attrition rate of nursing category, nursing cadres, if I talk about. So what we do, we also know that these many nurses will go. So we try our best, we make the best compensation plan for them, but at times it becomes difficult for us as well to be viable by providing them that compensation which they are getting in abroad, which they are getting in UK, US or UAE. So that's where we also prefer retaining the critical talent only. So what we have done, we have prioritized the list. We have only focused on retaining 20% of the talent, which contributes to 80% of our success. So basically critical care nurses, ICU nurses, CCU nurses, those kind of nursing talent we prefer to retain. And like general ward nurses who can be trained in 1 or 2 months, we prefer that, okay, even if they are going, we'll bring someone else who will do their job.
So are you open to, gig nurses? Have you actually tried them in your healthcare system in hospital?
Yes, absolutely. Even, when I was in Africa, I was there in Nairobi for 1 year. So there we had a concept of having nurses on locum basis. So whenever there was a shortage of nurse, we used to hire locum nurses. They used to come, they used to perform. In India, the problem is that, there are a lot of compliance requirements wherein you need to do proper privileging and credentialing of the nurse before we employ. So if these things are fixed up, so in India also we can do this thing. Currently, it's not there in the common practice. But yes, definitely the future would be like that.
Right. So, if I would ask you, what is the generally, what is the downtime, that is taken by the HR executives to find a new resource? Just to say, like a specialized nurse or a specialized doctor. So
for nursing, it depends on the kind of talent which you are trying to get. If you have to get a general nurse, you can get it in 2 days, 3 days, 4 days as well. If you have to get a nurse who is trained in critical care, you may take time of up to 15, 20 and even a month as well. If you have to find a nurse who is specialized in cardiac surgery, at that time you may even take 3 months as well. So it actually depends on the kind of talent which you are going.
So aren't you losing money in these 3 months? Because, patient care cannot suffer. It cannot stop.
So as part of the planning, which we already plan it in a way that even if 1 or 2 people go, we train other people who are able to do that job partially. So
you're multitasking
Absolutely.
Force
yes.
is what you're developing?
Cross-training is also one of the things which we usually practice, so that even if a nurse from cardiac surgery goes, we pitch in someone from cardiology, who has been trained in those kind of procedures as well.
Right. So, as you mentioned, skill gap, that's another a yawning problem in today's day and age. When the consumers are more educated, they want better care, they want better value for the money that they pay at hospitals. So, it remains an acute challenge. And upskilling, constant upskilling, not only of doctors, of allied health professionals and doctors, is an absolute must, if we want to stay ahead of the curve. So in this regard, we have a very important person who actually also bridges the gap, between hospitality and hospitals, since he comes from a hospitality background, interestingly. And he's now into upskilling nurses. So I would like you to talk more about this program of yours.
Yeah, so good afternoon, all of you. And, since morning we have been talking about the innovation in healthcare. And no matter how much technological changes we bring or innovation we bring in, the most important thing for this industry is the care. And the people who are actually on the floor are the nursing people. Because interaction with the doctor happens for a 1 or 2 minute period, or 3 minutes or 5 minutes maximum. Rest of the time, the patient stays with the nursing staff. So their skill set, the skill will, is very important. And at the same time, coming back to your previous question on retention, if I don't know, because you guys are actually from the industry, but if given a lot of training on the floor, it's going to help in retention also.
Absolutely.
With our organization, what we are doing is, the challenge that we faced, we run a hospital in Jaipur. It's a 100-bedded hospital, mainly into breast cancer and research and all that. So we realized that patients who are coming in, they are scared because first of all, they are suffering from cancer. And then the type of treatment and the level of treatment they receive, they need an empathetic attitude towards them. Somebody should actually empathize with them. So, and we realized that, I don't know about this part of India, but I know a lot about Rajasthan as one of the healthcare centers. There are a lot of nursing institutions or medical colleges also now. But these students who pass out, they lack in their skill set. And they lack so much that you will be amazed to know that a nursing graduate, does not know how to prick, how to put a cannula, and it becomes so awful in front of patient who is scared. And when you prick again and again, still you cannot place that cannula in the right place. So we thought of a program, which is a 6-month program, when we are actually taking the nursing graduates who have a degree in nursing. We take them, we put them for 3 months on a theory training and 3 months a bedside training. That's what we have been doing. And this is going to be the first batch, which is going to be completed in the month of December. So we have taken 30 students, and we have started generating demand for them. We realized that, in fact, the students also found it very interesting. They feel motivated, and their communication with patient has increased after this. So I think training plays an important role. Once they are trained, it's going to be an easy journey for patient as well as doctor also. And most of the hospital owners will look for numbers. So this care is directly proportionate to the level of satisfaction. Higher the care, genuine the care, and it gives higher the satisfaction, and then finally a loyalty index will go high, for sure. This is what a research also proves, right? So according to us, in this industry, the most important thing is education and awareness. We spoke about small duration programs like a GDA program, which is being run by Pradhan Mantri Kaushal Vikas Yojana, Rajasthan Skill Development Organization. These are the programs which are 3 months program, and you can actually take 10th pass student or 11th pass students who are underprivileged, who cannot go for higher education. I suggest, being the hospital owners or the HR people, you please get into that skill center mode where you don't need to hire many people. You just hire 10 students. Make them shadow the trained staff. Give them some theory training, and those are going to be your gig workforce. You can, like a locum sort of thing, you can always call them up when they are required. So that is very important. And whatever preventive care we are talking about, if your staff is not trained, if they are not aware, they won't be able to make the patient aware for this. So skill training is very important. And in Rajasthan, we have been working on this. With us, there are many other organizations who are working, like Bharatiya Skill Development University, which is again located in Jaipur. They have a beautiful health center, and I was very amazed to see that people from their tutors who are actually training these students are from Switzerland. So these are the Swiss trainers who are coming to India, staying in India for a year duration, and they are training these students. The skill lab that they have is better than any high-end ICU in the country. So that's the level of training they are imparting. And the students who are coming up are not the nursing graduates. Again, that's the gig workforce. So this is what we have been doing here.
Very encouraging trend. In fact, I think Rajasthan has a very robust pipeline of nursing colleges, and surprisingly, we find a lot of nurses from Rajasthan want to come and work, in metro cities.
The numbers are high, no doubt. As I said, mushrooming of institutions have happened. But very sadly to say that the objective of institution is not to train. And the objective of student is not to get the training part. They want degree and they want fees. And this is fact. This is fact. So this is what is happening. And actually, the sufferers are people like doctors and the hospital owners or the administrators, because we are the one who actually get the backfire when these people get on the shop floor.
Right.
So
nursing is actually the weakest link, I think, in patient care, as anybody who works in a hospital will vouch for. And in the race to plug the supply-demand gap, as you rightly said, so many nursing colleges have mushroomed up, but the quality of their production is woefully low. I mean, I myself am surprised to see a lot of freshly graduate nurses who don't even know, how to describe an intramuscular site for an injection. I mean, which is a basic nursing skill that you expect from a nursing. So, from a nursing graduate. So yes, I think upskilling has to take on from where these nursing colleges end, because obviously the quality is not good enough to be, hireable. Even their grooming standards, I think, even their communication, confidence, a lot of things actually need, upgradation.
Absolutely. We think that only in hotels we need grooming. But, it is a fact that in hospitals, you need a lot of grooming in the staff who are actually working alongside the patient. And one more thing, which is very important for all of us is look out for passion. When you actually interview, like Mr. Singh rightly said, to replace a candidate is a bigger cost than hiring a candidate. So, look out when you interview, in your initial interviews, look out for that passion, Are they actually here to learn and to grow with the organization? Because that is the most important thing, Sometimes these people, I see in my hospital, they come, they join, and because of this demand and supply gap, they get a job after 6 months, somewhere else, by having an increment of 1,000 or 2,000 rupees. Hospitals picks them up. There's no reference check that is happening within the hospital industry, I think we should, as one, with a collaboration, we should start with a reference check policy, so that at least they have this fear of getting their feedback, or the employer will take their feedback from the previous employer. It should be implemented. That will work to grow the loyalty part, for sure.
So actually, on that point, we at JOBIZO, at our platform, we actually have a very robust system of customer feedback where the employee and the employer both rate each other. So that you already know when you're hiring a gig worker, where he stands in the marketplace. That is something we've already incorporated.
That's fabulous, yeah. That's required, actually.
Yes.
In fact, there's a startup who has been working somewhere in south of India, and they are working on linking the healthcare professionals to their Aadhaar card. So it's going to be a portal where with their Aadhaar, their previous employment history would be attached. So if somebody is hiring someone, they can actually log on from the employer side, they can actually see the employment history. So people are working, actually.
We at JOBIZO as well, you mentioned the compliance part. All our professionals are background verified before they're even visible, to the employers. And a snapshot of their previous work experience and their complete qualifications is visible. So we are trying to create a platform like that where it becomes easier for employers to hire verified professionals.
Great.
Well, the recent pandemic actually, the silver lining to that dark cloud has been, I would say, a very accelerated adoption to technology. And artificial intelligence, as we know, can actually create enormous cost cutting in healthcare. So I'll now shift my focus to, Mukesh, who's helping hospitals and institutions use AI to their benefit.
Yeah, thank you. I think all the panelists has talked about quality of human resources. But same time, we are living into the new normal lifestyle, right? Everything today is being measured pre-COVID and post-COVID. Post-COVID, the biggest thing so far we have been in the textbook, health is the wealth. But really this pandemic has brought on the center stage health is really the wealth. And the kind of population, whether it is India or outside the India, the myth was there, if you have a great infrastructure, you have a great doctor, service provider, you are safe as long as you have the money. But see the data. The highest death rate happen in the developed countries. The reason behind it's not just about the quality, it is about intervention of technology is required in anything and everything. Because human has their own limitation. They can work, okay, India can work for 12 hours, 15 hours because demand supply issue. US and other things, they work on the basis of hourly, right? But patient, who's the most critical thing, it is the patient. So patient required, as long as they enter to your hospital, 24/7 attention, and apart from attention, facilities. So that is one part, but the moment they go back to the home, again, they required certain stage of screening and information. So for that, we have a product like virtual assistant, because you have the habit these days to ask the service on demand,
Yes.
right?
Sickness does not come at a stipulated time. I mean, you can fall sick any time of day or night. And I think the hospital front desk has its limitations in terms of hiring manpower. It's a cost
Correct.
As well.
Correct.
And it's a process which can be automated. The
Correct.
easiest, I think, the process.
Correct. So many of the things which is repeated in nature and which is like routine in work can be automated, and through the technology like AI, artificial intelligence. So saving cost is one part, and same time quality, because healthcare is very regulated thing. So information has to be perfect. It's not a half-trained staff. There is it's doing, I think, something very, very serious to the patient, because staff has to be 100% trained, so that patient should not be at the risk. So the moment you have like a digital assistant or virtual assistant, they perform what is being put inside, right? So if you say, okay, just example, you are like a diabetologist, you know that these are the things need to be in your day-to-day fooding habit, right? So then all this information patient can check through the mobile, through the apps, and now these things can be integrated on the social media page, it can be on the WhatsApp page, it can be the web page. So we have a product called Tina. It's a Tina, your healthcare assistant. So it is some sort of 24/7 services. It automate like your appointment system. So if you want to book the appointment at 10 o'clock in the night, it will integrate with your HIMS system. They will see what is the time availability, and based on that book the appointment with payment integration. This is one thing. Pre and post surgical or any kind of services, you want to do the reminders, do and don't. So all these things can be patient see it in the mobile itself. So it is, you are making it what is being through spirit, and later patient is aware about what is supposed to do. If it is not doing, because giving treatment is one part, second time things about patient really taking care about or not, what is supposed to do. Many times because of negligence, it is written in the English, patient is not aware about the English, or it is written in Hindi, they are not aware, they have their mother tongue is some other language. So this product is multilingual. If somebody want to interact in Punjabi, they will get the answer in Punjabi. Somebody is in Telugu, they will get the answer in the Telugu. We do cover close to 80 languages. So that give the comfort, ki, okay, even doctor is not there, but somebody is there. And in case of emergency, there is a provision, just a alarm, like a hotline kind of thing there. And hospital is also supposed to understand it is a hotline. That means it's really emergency. So somebody will pick up the phone.
So I think it's interesting that you have 80 languages
80
in your
languages.
drop-down menu. I think a huge potential to penetrate even into tier 2, tier 3 cities and help out the patients there. Your platform has interoperability with the hospital software
Correct.
systems, with different systems, because
Yeah.
every hospital has its own
Yeah, so it
interface.
can be integrated with your HIMS system, it can be integrated with your ERM system. So it is like a complete solution from patient to hospital and hospital to your internal communication.
And how do you ensure that this interoperability is very smooth?
Because it is connected through this API system, so what is the data inside, the same thing will be coming out there. So anything which can be done during this testing period itself, so you 100% sure it is working quite perfectly.
And who drives the adoption of this technology by the patients? Is it the hospitals who ask the patients to adopt this technology to get in touch with them?
It is both way. I think first stage is that first hospital and hospital staff understand what is the benefit of this technology. Because we heard since morning that too much stress are there. So first thing, this is going to help the staff. There are a lot of regular work can be automated, so you have ease. You are now working with a more relaxed mood, so you can be able to contribute much better in the productivities there. And second, once staff is there, then we do train to staff, okay, if some patient is inquiring something, give the 1 or 2 line answer and then say it is already there in your mobile, so why don't you check it there?
Right. So with the amount of this huge data that you would be collecting, in the future, you know, and AI systems learn, and they get smarter over time,
Correct.
and more superior over time. How do you intend to use all this data, and how do you intend to channelize it into predictive analytics for the betterment of the hospital?
Correct. So even morning we heard the data is basically the wealth these days. So when suppose in the hospital, if you're getting 100 patients every day or 1,000 patients every day, many of the data need to be collected. Right now, since you are just talking, nobody is capturing the data. Now it is happening through the text. So you know that patient behavior can be understand. Your practice behavior can be also based on the data can be predicted. Okay, this hospital required to be more diabetic is coming, so like you need to strengthen your diabetic clinic, you need to strengthen your lifestyle related disease there. So this will help you to better practice management for the hospital point of view.
Will it also be suggesting doctors to patients? Promoting certain...
Yeah, AI is already doing. Right now, we are not on the clinical side, but based on the trend, it will also say, okay, these are the things that this is supposed to be happen, so start taking care about that.
So I was actually reading somewhere that, you know, Netflix, about 80% of people watch programs on Netflix driven by the auto-suggestions, you know, based on their previous history.
Correct.
So I guess this is something like... I mean, this...
Yeah, future like it is going to make even the clinical doctors and other things is much easier, because right now you're putting a lot of efforts and a lot of screening is happening to find out what is, and again, end of that is not 100% guarantee what you are thinking, it is the same. But this will give you very early stage, these are the trend, so it need to be addressed. So this TINA can help you to understand what is the trend, and based on that, treatment plan can be done.
So maybe certain doctors will get more popular and certain doctors will have to upskill. So maybe, they will have to be an upskilling institute for doctors as well in the future. So well, thank you everyone for your great inputs, and I really enjoyed this discussion. Any questions from the audience, please? We'll be happy to take them. Well, I guess there are no questions. So thank you, panelists. Thank you so much. Sure, ma'am.
So that's the point where which I was highlighting during my discussion as well, that to ensure those quality, we should have a strong competency assessment of the people who are coming on board. So, and that's the point when, she was telling that, with the platform which they are creating, they are verifying the credentials. The next step can be assessment of the competency of the person. So whomsoever is even being employed as a gig worker needs to be assessed on the competency part, and if he or she clears the competency assessment test, then only he should be deployed to perform certain tasks. I think that's how we can have some control.
Ma'am,
Yes,
if-
yeah,
Sorry,
please.
if I may actually answer your question. So like on our platform, which we'll be mentioning now in our presentation, you can integrate, skill assessment tests for the people that you plan to hire. You can have induction modules, you can have training modules. There is in-app video interviews that you can do before you actually decide to hire these gig workers, and ensure that there is no care variation in your regular, full-time resources and these gig workers. So yes, you have to partner, with a platform like this, any digital platform, to make sure that the personnel that you're hiring are of a certain standard that is acceptable to your organization. So yes, it is very workable and it is happening and it is essential.
So it is as simple as that. For an example, even if a Ola driver is being hired, he performs as a gig worker. So his driving license is there in place. Those are the checks which Ola puts before giving him, because being associated with him. That kind of check needs to be ensured for hiring any person in any industry, be it is healthcare or any industry. Yeah. Right. Absolutely. Absolutely. Absolutely.
Ma'am, you'll find our presentation very interesting because we're going to cover all these points. Thank you very much.
Thank you
Thank
very
you,
much,
everyone.